Describe the types of bronchial breath sounds with causes. Ma'am, bronchial breath sounds, ma'am, they can be heard over the mediastinum, ma'am. Just um, above the clavicle, it says. So these are normally high pitched and tubular, you can say. So the inspiration will be short, the expiration will be long. There is a gap in the middle or a pause in the middle. Inspiration and expiration. This is bronchial breath sounds. And the three types of bronchial breath sounds are tubular, cavernous, amphoric, TCA, tubular, cavernous, amphoric, in which tubular is the normal one which you can hear over the large airways. So this will be high pitched and present normally over the large airways. However, it can also be present in other places in diseased lung, that is consolidated lung, pneumonic consolidation, airless. If it is airless, then it can be there. If there is a collapsed lung or lobe and there is a draining bronchus which is patent and above the level of pleural effusion, in a partially collapsed lung with patent bronchus. If there is patent bronchus, then tubular. Okay. Cavernous and amphoric are low pitched. These two are not heard normally, they are saying. Cavernous will be there in thick walled cavity with communicating bronchus. Amphoric will be in smooth walled cavity. And amphoric is more metallic, high tone. It can also be there in bronchopleural fistula and tension pneumothorax, ma'am. Thank you.